Your sentence is the continuous coverage provision. And now that's the provision that says if you have an interruption in your health insurance and you want to go back on health insurance, then you have to pay 30% more than you would have paid otherwise for a year. You said the continuous coverage provision offers a perverse incentive to the young and healthy to sign up for coverage only when they get sick. So why is that?
Well, because you don't incur the penalty unless you try to purchase coverage again. Mm-hmm. And so the people who feel like they're going to be healthy in their daily lives are not going to sign up if they didn't get, if they were blocked from coverage for a certain amount of time. They're not going to have to go back until they get sick, because this bill, because of the way it's being done, retains this concept of you cannot be denied coverage for a pre-existing condition. So you can get coverage whenever you want, and you only get penalized for not having coverage when you try to get it. So if you just do the math, if you're a healthy person, you're not going to get coverage unless you're sick. And what that means is the risk pool of those insured is going to be far sicker, and that makes it very difficult for insurance companies to really survive. And what this is commonly known as a death spiral.
Right. And now I was one who felt that even, first of all, I hated the individual mandate, since I'm an old lefty who thinks that, you should fund these things through progressive taxation in the end. But to me, I understood why it was done actuarially and so on. But to me, this is even worse, because as I predicted and as we saw, and I think you probably predicted it too, even the tax penalty for not getting insurance under the Affordable Care Act wasn't enough to prevent the kind of adverse selection you're talking about. This is going to be, I think, that much worse. And by the way, also, the money doesn't go to the government to fund healthcare initiatives. It goes to the insurance companies themselves. But as you say, it probably won't be enough to make up for the risk.
Well, so that's the extreme irony of this whole thing, that if you pay a penalty to the government, it's tyranny. But if you pay a penalty to a private health insurance corporation, it's liberty. I don't understand how that works. But you're absolutely right. This is kind of the worst of all possible worlds. I mean, single payer is a mandate, right? Single payer says that everybody is going to be covered, and we solve the problem of who pays by having everybody pay through progressive taxation. This thing is there's no mandate unless you get sick, which just guarantees a sicker group of people who are insured, which guarantees rising prices. Because there's no cap on prices necessarily. There's this sort of age band between the old and the new, which actually grows under the Republican plan. AARP is calling it an age tax. But, and the 30% penalty, of course, what's bigger than 30% of $100? 30% of $200. Right. So even that is an incentive towards rising the price, because the penalty will be higher as you increase the price. Right. So by every measure, this is going to mean higher premiums, higher deductibles, higher copays, and a sicker population within that insurance market of the individual market, which is going to make it hard for that market to survive.